Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Liana Maisara binti Mazlan from Bachelor Medical Imaging Cohort 14A. So today my presentation is about methods of moving patient. As we know, not all patients that are receiving treatment in the hospital are able to walk. Therefore, learning about this are very important to help them move throughout their treatment in the hospital, especially when they undergo the radiographic examination. There is actually a lot of methods can be used, but today I'm gonna focus more about moving patient by using wheelchair and one-person lift. Means like you gonna move the patient by yourself, but just in case you are not able to support the patient by yourself, then you better ask some help from the other staff to avoid any injury to the patient and also to yourself. Okay, so when transferring the patient from the bed to the wheelchair, there is actually 3 phases you need to know, which is the first one is sit up the patient, and then the second one stand the patient up, and then the last one is sit the patient down. So without further ado, let we begin with the first phase. Okay, so first of all, when we meet our patient, the first thing we need to do is to introduce ourselves by our name and then our profession, and then describe to them what you will be doing, give them a clear instruction, and then if you have a gait belt, you can use it as it will help you to grip the patient while moving. But if you don't have one, then you can just clasping your hand behind the patient back while moving. And then when you have a gait belt, the next step you need to do is to open the wheelchair and put the wheelchair near the bed, not too close to the patient but just near the bed, and then put the gait bag on the wheelchair first until you need to use it, and then again explain to the patient what you will be doing to make them understand and clear to the instruction given. Make sure they are ready to move, and then ask the patient to move his body a little bit closer to you. Next, put your arm under his shoulder and then your other hand over his knee, and then bend your knees and pull his body toward you, like swing the patient like this until he's sitting on the side of the bed, at the edge of the bed facing you, and then wait a few seconds and ask the patient whether he feel any dizziness. Okay, so next, take the gait belt and then place it around the patient's waist. Make sure it is fit enough for you to move the patient later, because when moving the patient to the wheelchair, you have to grab the gait belt. So if you don't have one, so later you just have to use your hand and then clasping around the patient back. And then for this phase, before you help the patient to stand up, make sure they are wearing non-skid slippers to avoid them from falling. So then bring the wheelchair as close as possible to the patient and lock the wheel to avoid it from moving, and then ask them to scoot to the edge of the bed and lower the bed so that the patient's feet can touch the floor, and then tell them to put their hands on your shoulder while you grab the gait belt, and then place the patient's leg, which is the one that farthest from the wheelchair, and then place it between your knees for support. Okay, so lastly, you need to bend your knees and then lift your legs so you can make a pivot turn to lifting the patient and sitting them on the wheelchair. And then after that, keep your knees bent until the patient's legs are touching the floor, and then remove the gait belt gently, and then help them to place their legs on the foot pedals at the wheelchair, and then you can ask the patient if they are comfortable with the wheelchair, with the seat, or they need anything else. Okay, so the conclusions here: make sure you follow the step carefully and organize the flow of the steps in your head to avoid any mistakes. So that's all from me. Thank you.